Hi, good afternoon, everyone. Thank you for joining. We're going to go ahead and get started. Thank you for joining our webinar, Eat Smart, Move Smart, Live Smart, Youth-Led Obesity Prevention in School-Based Health Centers. We have a few housekeeping announcements for you before we begin today. Firstly, if you're viewing this webinar with a group, please go to the chat box in your GoToWebinar window pane and type in the name of the person registered as well as the total number of additional people in the room. This will help us with our final attendance counts. You may download this webinar presentation by visiting our website at sbhforall.org/webinars. All attendees are in listen-only mode, but we do want to hear your questions throughout the webinar. If you have a question, please go to the chat box in your GoToWebinar window pane and enter it. We will hold all questions until the end of the webinar. School-Based Health Alliance archives all of our live webinars. To view our webinar archives, please go to www.sbhforall.org/webinars. By the end of this webinar, we expect you will be able to gain an awareness of the trends and prevalence of youth obesity in schools and communities, gain an understanding of successful youth-led tactics used in school-based health center settings in various states, and obtain practical resources for programs and initiatives that can be utilized in school-based health settings. So before we begin, we're going to start off with a poll question. Are staff or students aware of concepts such as food or desserts and other access issues? We'll give you about 30 seconds. We'll give you about 5 more seconds to respond. Great, thank you everyone for responding. It looks like we're not quite split in half, but we have about 57% that said yes, there is awareness of these concepts, and 43% said no. Today's presenters are Nicole, Carmen, Selena Moore, and Emily Weigel. Nicole is from Omaha, Nebraska, and is currently a junior at Omaha Northwest Magnet High School. Over the summer, she worked with an organization that supports school-based health centers in her community to help start an obesity prevention club at her school. She is very involved in her school and community and participates in clubs like National Honor Society, Student Council, Thrive, Healthy Huskies, and loves to volunteer. One of her goals in life is to leave a positive mark in her community and recognize that hard work and commitment will help her achieve her goals. Carmen is a junior at Roswell High School in Roswell, New Mexico. Her passion for volunteer work keeps her involved in a multitude of projects each year. Carmen's 2 favorite projects are teaching swim and writing lessons to children living with Down syndrome and a group she founded called Impact Teens. Impact Teen is a group of young women who strive to improve their community and school by raising awareness about different health issues and is sponsored by the School-Based Health Center at Roslyn High School. The motto of Impact Teens is helping ourselves while helping others. Selena Moore serves as a program associate for School-Based Health Alliance. As a member of the Programs and Professionals team, Selena supports a variety of technical assistance, training, and continuing education efforts for the school-based health sector and oversees our organization's Youth Advisory Council. She graduated from The Ohio State University with a BA in Globalization Studies and a Public Health minor, and obtained her Master of Public Health at the University of Virginia. Emily Weigel is a graduate student from the Yale School of Nursing, Management, Policy, and Leadership specialty. She is working with the School-Based Health Alliance and assisting with the Youth Advisory Council. And without further delay, I'll turn it over to our presenters to begin today's presentation.
Great, thank you. So this is Emily. Welcome, everybody. Thanks, and it's good to see we've got some folks who have some awareness of this, and for those who don't, hopefully we'll answer your questions as we go on. And I do just want to clarify really quick, especially in case parents or grandparents are listening, Carmen is actually Cameron, so just a kudos to you. All right, so basically we're doing a little bit of background, lay of the land here, and as most of you probably know, research has shown that school health programs can reduce the prevalence of health risk behaviors among young people, and they have a positive effect on academic achievement and lifelong behaviors. More specifically, and one of the reasons that we're here speaking to you today, is that schools do play a critical role in improving the dietary and physical activity behavior of students. Part of what we want to get across to you today is that schools can create an environment supportive of students' efforts to eat healthy and be active by implementing policies and practices that support both of those things. And really, kind of a big picture item, the CDC says that obesity now affects 17% of all children and adolescents, and that's triple the rate from just one generation ago. With all the bad news coming about obesity, however, in 2013, they started to change the trends. So the policies that are being implemented are actually starting to work. Policies such as healthier foods in schools, decreasing the sodas in the vending machines, and they're noting that among 2 to 5-year-olds, obesity rates have decreased from 14% to 8%, for example. So some great things are happening along those lines. So what are we talking about here? So one of the things that we're looking at is some of the root causes for these. We've got kids who are in neighborhoods that we consider food deserts. And for those of you, food deserts, we want you to understand that those are places where it's an overabundance of convenience or fast food stores, and the kids and families don't have access to healthy foods. What's sold at these stores are packaged foods, and the kids, that's all they know. They're not exposed to any of the healthy foods, where supermarket access is associated with a decreased risk for obesity. So for the students, and a lot of them living in the food deserts, that's a big piece of the dilemma. We've also got a lot of sugary drinks, and then also there's a lack of safe and appealing places in many communities for kids to play or be active. In fact, half of the children in the U.S. don't have a park, community center, and or sidewalks in their neighborhoods. So that's something else policy-wise that we'll be looking into. Okay, got a poll question for you here. Does your school-based health center actively promote healthy eating habits or nutrition education?
We'll give about 5 more seconds.
All right. Okay, so it looks like we've got here, excellent.
Begin nutrition is the process of obtaining the food.
All right. So just a couple more things for you here regarding policy. A lot of folks don't realize the policy background and all the work that goes into trying to make schools a healthier place for our kids. kind of behind the scenes work, and it's actually very interesting. So in 2010, the Healthy Hunger Free Kids Act was passed, and this legislation helped make sure that we got healthy foods into kids' schools. It had been going on for a while, but there has been no update for 15 years. So the science behind the food that was in the schools wasn't up to date. And with all the new up-and-coming research that's been done on kids' health, this legislation made sure that we did have healthy foods in the schools for kids. Another thing that they've got is a local school wellness policy. So each school has its own policies that it can implement, but it has to follow some guidelines that are part of the legislation. And they have to be specific for nutrition promotion in the schools. They have to be specific for nutrition education. So it's good that we see a lot of yeses up there, 90% of yeses. It's good to see that hopefully the school wellness policy is in effect. Another thing that has to be part of the school wellness policy is physical activity guidelines and other school-based activities that promote student wellness. So just having that as part of the policy in a school has really helped this obesity epidemic start to be nipped in the bud there. Another one is just the nutrition standards for the school meals. As we talked about, the Healthier Hungry Food Kids Act made sure that our nutrition standards were actually implemented in the schools. A new thing in 2015 is a Farm to School Act, and this has been pretty exciting for some communities where there's a lot of local farms. It ensures that there's procurement of healthy foods from local farmers and shipped right over to the schools. They also increase education around this, and they also have school gardens, and they're getting some funds to help the schools start their school gardens. And the schools that this has happened, it's been a fabulous success. Kind of on the side, an exciting thing that had been going on in North Carolina, for example, they have a Healthy Food Small Retailer Corner Store Act. So as we were talking about food deserts, an example of a food desert is a neighborhood that has lots of corner stores, but they're not stores that have anything healthy in them. They're all packaged foods, and this Corner Store Act is making sure that these retailers have some funding to get refrigeration in the front of their stores and stands to put fresh fruits and vegetables in so that the kids and families can be exposed to this. So that Healthy Food Small Retail Corner Store Act in North Carolina is a great example of how things are changing. Just something interesting, they've got a House bill that would expand nutrition and physical activity education in medical schools. So they're starting to bring this back to the medical school education so that your physicians are aware of all the things that are going on. And at the end of this presentation, we'll have someone that's going to talk to you about some of the things that the School-Based Health Alliance is working on and things that are happening in the school-based health centers and some takeaways for you. There's just a small little graph there. It came up pretty small on the slide, so my apologies, but it's got the light blue and the dark blue graph there. And what that is showing, the top three are talking about how many hours kids watch television and as it correlates to their grades. Thank you. So what we've got there on the 0 to 100 scale is the percent of students who engaged in this behavior. So we're talking about physically active, 60 minutes a day or fewer, and the kids, you can see that they got mostly A's if they were physically active. The kids who did not play on at least one sports team didn't do quite as well. It's not that you have to be on a team. That's a physical activity piece as well. And then watching television 3 or more hours per day, the kids who watched more TV, their grades weren't quite as good. So the physical activity really does affect your grades in lots of different ways. And then the next one talks about healthy eating habits. Basically, the healthier your habits are, the better your grades are. And they're just showing the strong correlation for this for the last 10 years of research that has been shown. So there's a lot of research behind what we're talking about, healthy foods and physical activity for the kids. It's not just a feel-good thing. Scientifically, it's been proven, and the CDC and the Health and Human Services is really trying to push this forward with the kids in our schools, and they do deserve it. Go ahead. Yeah. All right. And just talking about some of the trending data, we just did speak of some of that. And one of the things that we want people to know, the Robert Wood Johnson Foundation has a lot of programs going where they're helping the healthy kids, healthy communities get into the schools. So there's a lot of programs that they're promoting. School-Based Health Alliance also is doing a lot of programs, and the CDC has a lot of recommendations. So if you go on to any of those websites, you'll be able to get some information if you wanted to pull some of that forward into your schools. Selena's going to be talking about that as we go forward, however. All right, I'm going to go ahead and turn it over. Our next speaker is actually pre-recorded. We've got Cameron coming up. So you go ahead and maybe you might need to turn your speakers up if it's a little bit faint. Cameron, as you noticed, was one of our Youth Advisory Council members, and she's got her input here.
To begin, nutrition is the process of obtaining the food necessary for healthy growth. To have good nutrition, one must make healthy choices. This means eating the correct amount of food from all the food groups. Vegetables and fruit are sources of potassium, dietary fiber, folate, vitamin A, and vitamin C. They can also help reduce blood cholesterol and lower risk of heart disease. Grains contain B vitamins and minerals such as magnesium and iron. Lean and low-fat proteins can provide iron, zinc, and vitamin E. But too much of anything can be a bad thing. Eating too much in general can cause too many calories to enter the body that the body cannot burn off. There must be a balance between eating enough nutrients and not eating too many calories. For many people, though, they only have access to foods with little nutrients and high calories. 29 million people do not have access to healthy foods. Millions of Americans live in food deserts or in areas where affordable and nutritious foods are not available. Schools can help people find a great balance between good nutrition and eating the correct amount of food. For some kids, schools provide 2 meals a day, 5 days a week for 13 years. Schools are the perfect place to teach children about healthy foods and eating the correct amount. The Healthy, Hungry, Free Kids Act, the National School Lunch Program, and the School Breakfast Program are being implemented. These programs are directed at giving children a variety of fruits, vegetables, and grains in the portions that are recommended by the Institute of Medicine. But what can we do to help? The best thing to do is to teach, informing people the importance of good nutrition in schools. And the best way to do this is by being an example and being nutritious yourself. Teaching others by being healthy is something that can not only help you, but help others. In many communities, the school is the only place where kids can have healthy food. In Detroit and New Haven, the produce quality is lower in low-income communities of color compared to the affluent or racially mixed neighborhoods. In Albany, New York, 8% of non-white residents cannot find low-fat milk or high-fiber breads in their neighborhood. And in Baltimore, 46% of lower-income neighborhoods have limited access to healthy food. Based on a healthy food availability survey, compared to a 13% of higher-income neighborhoods. In communities, we can definitely help this. Instituting more supermarkets can boost the community, providing jobs and great healthy choices. But of course, not all of us can buy supermarkets, but we can donate to local food banks. This is a great way to provide our community with healthy food. Another option is starting a community garden. This can provide a great resource for the people in the surrounding area. It is great for the health and for the environment of people around. What I have done in my life is I've done a balloon basket. I live in New Mexico, and hot air balloons are huge. At my local middle school, we spent 1 month filling the basket of a hot air balloon with healthy food for our kids. At the end of filling the balloon, or after the end of filling the basket, we donated all the food to a local food bank called Harvest Ministry. So of course, healthy food isn't only one part of being healthy. Another part is moving smart, and that is the next step that will be taught by Nicole.
So we now have another poll question. Are physical activity options beyond organized sports available for youth at your school?
We'll give you 5 more seconds to respond.
So it looks like we have 58% of you said you do have physical activities beyond organized sports available, and 42% said no. So nicely surprised that there are options. We hear a lot that outside of sports that are already, whether they're varsity or JV for after school, there's usually not other options beyond just gym. So it'd be really interesting when we come to the close to hear questions. I also like to hear your comments, kind of share what are these other options that your schools are offering for students.
What is physical activity? Everyone talks about it, but does everyone know the actual definition? So it's defined as any bodily movement produced by skeletal muscles that requires energy expenditure. So going on to some background information. So children from age 6 to age 17 need at least 60 minutes of physical activity a day. And in 2013, 27.1% of high school students had 60 minutes of physical activity a day. So only 20. So what are the benefits? So you have healthy bones and muscles, obviously. But you also have a reduced risk of depression, anxiety, obesity, and multiple chronic diseases. It also promotes holistic health, and it helps academic achievement, concentration, attentiveness, and even sleep. So the results of inactivity are anxiety, depression, high blood pressure, diabetes, obesity, dying prematurely, and self-esteem issues. So we have an unfortunate fact that while 77% of children ages 9 to 13 participate in free-time physical activity, this number decreases to 20% by the time the students reach their senior year. So we go from 77 to 20%. One has to wonder, why does this happen? Why do we have a 57% drop in the physical activity? Some might say that it's because of social media and an increase of technology in the everyday lives of the youth. Participation in physical activity declines as people age. And this starts off, so in 1 to 7, when they're 1 to 7 years old, their job is to play. They learn by experience. They're learning cause and effect. They get to use up all of their energy outside and inside of the house, and that's all they do. That is how they're learning. But that changes when they turn 8 and into when they turn 10, is that they learn that they can play after the homework is done. So right now, academics are already being put in front of physical activity or athletics. And they only have PE a few times a week. And so right now, they're learning that in order to participate in these physical activities, they have to have all of their homework done. And you can see even consequences being put in place where their PE classes and even their recess are being taken away if they come to school unprepared or without their homework. And when I was wondering, first of all, if that's even right, but also this is already this is when the children are already learning their habits, and so they have already, they're starting to get this mentality that PE and recess might not be necessary. And to add to that, when they're 11, they're 13 years old in middle school, they start feeling very self-conscious about their athletic ability. Especially even girls, they don't want to sweat in front of guys because it's not cool, and guys try to outdo each other, and so maybe those guys that are not athletically gifted, they start feeling more self-conscious about themselves because those that are just doing such a better job than them to succeed. And by the time they get to high school, it's a choice. It's academic or athletic. Why should we even care about it? It affects the future of the youth. It affects teens' everyday lives. Again, going back to the results of inactivity, that obesity, that depression, that anxiety, and that inability to focus, it affects everything that the teen does, especially right now that it's so important to do well in school and get all these and get scholarships for college. And it not only affects us like the physical with the outward appearance, but it affects how the brain thinks and how the brain works as well. Proof. I am not athletic. I don't take a PE class in my school district. PE is only required for your first 2 years of high school, and after that you have the option to take PE. I'm hardly ever home. I have a lot of after-school activities and clubs that I'm a part of, and I'm a leader in helping promote healthy living in my school. And so you can see, the two, almost polar opposite. In 7th grade, I tried like volleyball and basketball, and I tried to be that athlete, but I wasn't. And I was told that I wasn't, and so I figured if I'm not going to do well, or I'm not going to, be a state champion in a sport? Why even try? But in January of this year, I made the decision that I was going to practice what I preach. I decided that I was going to eat healthy, like Cameron mentioned, was so worth it.
Everyone, we're going to do another poll. So this poll question will be, is your school-based health center utilizing Drink Up or Let's Move campaigns to promote awareness and take action? And we'll give you about 30 seconds to respond. We'll give you about 5 more seconds to respond. Thank you so much, everyone, for your patience. We're having some audio difficulties on the webinar today, but we do see that many people on the call today are not currently utilizing the campaigns of Drink Up or Let's Move. About 87% said no, but 13% of you are. We'd be very interested in hearing about how those campaigns are going in your school and your community when we open it up for questions and comments.
And a little bit of background on the Drink Up or Let's Move. In 2010, First Lady Michelle Obama created the Let's Move campaign to help kids be active and eat healthier. It's just a simple program that people can institute in their schools, and it doesn't have to be a formal physical activity program. You can kind of do a homegrown activity with the kids on a daily basis or at a certain time of day or during announcements, and it's been a real fun activity for a lot of people. So it's not complicated at all. You can look into that, and we really encourage you to. And Drink Up is along similar lines. It's a simple program, and it's really been successful in a lot of schools.
And so now we will move on to basically some takeaways from what you've heard so far, the background, the policy from Cameron about being nutritious, and from Nicole about physical activity importance. And what we know, as well as I'm sure all of you know, is that there is a critical need to address obesity prevention overall, but especially with our young people, and trying to start as young as possible to remind them about eating well and getting outside and playing and running and being energetic, and how that can stay with them throughout all those stages that Nicole talked about. But within the school setting, like with anything else, there are issues of access and of time. And so what we've tried to do and show you both the resources that the School-Based Health Alliance has, as well as many different national partners that are trying to meet you where you are to address issues of access, as well as incorporating these into the school day, not adding to it, so that you really can make a difference with the youth and involve them in their own wellness. One thing we'll also say about that is that obesity prevention and the wellness type of plan you do is not a one-size-fits-all. It's very customizable, and it may differ by the school, by the community, even by the student. But school-based health centers can be that catalyst for change and are the ones that can not only address what's going on when the youth come into your clinic, but can reach outside clinic walls, partnering with teachers, partnering with administration to really make this a school-wide community approach. And most important of all, the youth themselves need the positive role models and motivation to feel like they want to make successful, permanent changes in their lives. And they, too, also have the capacity to provide input and to help you figure out what type of programming or initiatives you want to be involved in. So not just providing these opportunities to them, but making them a part of whatever message you decide to craft. And so just getting into a few of the resources, here at the School-Based Health Alliance, one of our programs is Hallways to Health, which is in partnership with Kaiser Permanente's Thriving School Initiative. And we work to combine the school-based health centers within our state affiliates, helping them partner between organizations, the school-based health centers, and the state affiliate to address three main areas: obesity prevention and treatment, social and emotional health, and school employee wellness. And from across the country, different schools are implementing these programs in their own way based on the resources that they have and what was of most importance to them. And as mentioned before, with Thriving Schools, which everyone can access, you don't have to be a part of Hallways to Health to use. Through their website, they offer all of the same resources, whether you want to focus on healthy eating or you want to just focus on physical activity, or both, working with not just students, but helping teachers and staff as well promote their own healthy living. And you can log into their website, incorporate their activity plans. They also provide assessments. Along with that, a major partner is the Alliance for a Healthier Generation. They actually also have where you can register or log into your school or school district. And across the country, they're working with different schools to implement sound changes by assessing where you are, creating your own action plan. You're able to share these results online with other schools in your areas or within your own district, across the country with them, and celebrate your changes. They provide technical assistance and training and are a really great resource to help get your healthy living school programs off the ground. Along with that is Action for Healthy Kids. They have an Every Kid's Healthy Week, which just passed last month, but it comes around every year, which is really an annual observance to celebrate the fact that schools are the epicenter for children and their lives, and that school health is so important, not just physically, but socially, emotionally, the environment that you're in, and what happens in and out of the classroom work in tandem. And so they have a really fun interactive game on the website that you gather your team of school-based health center professionals, your teachers, staff, your students as well, if you have a youth-led school-based health center group, and you can look at each of these different areas of the school, regardless of your level, elementary, middle, or high, and see where you can implement some healthy living activities into the classroom. Maybe it's the first 10 minutes is really about, stretching and getting out of your seat. You can do it in the cafeteria, thinking about the food that's served, on the playground, really incorporating new and fun games. And another great resource, there are so many of them, but one that we're also wanting to highlight is an alternative way, thinking about in the classroom how to both combine the teaching time with the active time, and that's through the walking classroom, where you can pre-record your lessons, whether it's social studies or math, and students can listen to them through the podcast while they're outside walking. You can have your classroom still contain their lessons, but outside of the traditional classroom setting. And on their website, they offer ways for you to apply for grants to get these podcasts and provide you with templates for lessons that they still go in line with, that you can customize them to your school district or your state's requirements for the learnings in that grade. And so from all of this, there are some action items that we wanted to share with you guys wherever you are, whether you're just starting thinking about how to incorporate healthy living through food and active lifestyles in your school, or if you already are doing some of the Let's Move program, or if you're already partnering through some of thriving schools, how to increase it. One of them for sure is to form a youth advisory council or work with youth in your school that are already interested in doing this type of work, or who you just happen to see frequently in your school-based health center, and you say, hey, are you interested in helping us kind of form a group that's all about the students and their lives and being successful in school. So starting with the youth, you can partner with teachers who also have shown interest. A lot of our schools have worked with the physical education teacher to help with finding alternative ways just outside of not only the time allotted for gym, but how to bring it into other areas of the school day. From there, you can choose a campaign or program like the ones we just spoke about, or you can start one that's already happening in your school, like Cameron said with them having the hot air balloons. That was something that was already taking place, and they made it fit into the idea of thinking about nutrition. That's another way to go about it. Or starting, as mentioned, a community garden or a school garden. If you're in an area, which most of us are, that have farms, seeing if a local farmer would like to come to the school, talk to the students about the work that goes into creating food that's healthy and safe and also fun to eat. Or bringing in, a local business, maybe a yoga, to bring in some alternate ideas to health in the gym room. Along with that goes with connecting with local orgs and in the neighboring schools. Going back to what you can see on the Alliance for Healthier Generation, you can see other schools in your school district that are already partnering with them. Connect with them, see how the programs are going. Maybe you guys can partner together to do a family health night, as some of them have done. And then most importantly of all, sharing your stories, sharing them with each other. All of these different platforms have medias where they want to promote the work that's going on. We'll never be able to fully address the issue of childhood obesity if we're not working together and sharing the best practices and the success stories of how to really turn this around and not make it about obesity treatment or prevention, but just about well living. So share your stories, and especially with us, if you have any thing that you want to share or pictures, please send them to us. We'd love to hear about it. We'd love to promote it and continue the conversation. And so all we have to say after that is thank you guys so much for coming and listening to what we all had to say, especially to Cameron and Nicole. If you would like to hear them in person and learn more about the stories of what they're doing in their schools with their school-based health centers, as well as these programs and many of the other ones that they've been working on throughout the year, come visit us in Austin in June 16th through the 19th for our national convention. The School-Based Health Alliance is celebrating 20 years, and we have a fabulous youth program plan, and we want you to bring your youth, let them learn more about engagement, the issues around health policy, advocacy, leadership. We would love to have them there, and we'd love to see you as well.
Thank you so much, Selena and Emily, for a great presentation that highlights a lot of really usable resources and actionable items that I hope everyone on the webinar feels like they are energized to take back to their communities and start initiatives today. So at this time, we'd like to ask for questions, comments. Emily and Selena would be happy to respond to them. You can enter your questions by using the chat box in the GoToWebinar window pane. And while you're entering your questions, as Selena said, we are celebrating our 20th anniversary at this year's National Convention. Registration is now open, and more information on all of our sessions, including our youth advisory youth track, is available on our website. School-Based Health Alliance is a membership organization. We are the national voice for school-based health centers, and we rely on membership support. If you're not currently a member, we encourage you to join. We have two membership options, individual and organizational. You can learn more about the benefits of each membership type by visiting our website at www.sbhforall.org/membership.
All right. So just a reminder, because a lot of information came at you today. If you do go to our website, we do have a space on it that talks about a lot of the things that we mentioned. So if you go to the School-Based Health Alliance, and it's titled The Hallways to Health Resources and Tools. And underneath that just talks about a lot of the different things that we talked about, farm to school, Let's Move Active Schools. There's a fruit and vegetable prescription program that's highlighted. There's Cooking Matters, where there's an organization, Share Our Strengths, Cooking Matters. You can do some cooking classes in your school. The CDC's School Health Guidelines to promote healthy eating is on there. And there's also the CDC School Health Index. You can look at the areas where your schools are and see how they're doing. There's also the Alliance for a Healthier Generation, Healthy Schools program. And also there's one called Fire Up Your Feet. And that's talking about safe routes to schools as a national partnership to get kids to walk a little bit more. And just so that you know, these things are available for you. You don't have to remember everything by memory what we just told you. There's a lot of stuff going on. It's really exciting. And the obesity rates are just starting to come down, so we're excited and we want to keep this moving forward.
Thank you, Emily. If anyone has any questions for Emily, Selena, Cameron, or Nicole, we'd be happy to receive your questions at programs@sbhforall.org. We do have a few closing reminders for today's webinar. This presentation has been recorded, and it will be posted to the School-Based Health Alliance website in 2 to 3 business days. For more information on our Youth Advisory Council, please visit the Engage tab on the School-Based Health Alliance website. Please take a moment to fill out 3 polls that will appear on your screen. It's helpful to know how we're doing so that we can continue to meet your needs. The first poll question is, did this webinar meet your needs? Thank you. The second poll question is, did this presentation provide you with usable ideas or techniques? And the final question, would you recommend this webinar to others? Thank you, everyone, for attending today's webinar, and a huge thank you to Emily, Selena, Cameron, and Nicole, to Emily and Selena for the wonderful information they provide today, and to Cameron and Nicole for the huge role models that they play in their communities, and a huge congratulations to the successful initiatives that they have helped to implement. Have a great afternoon.